Allie. Can I have you confirm your date of birth for me?
Jeff Pass, October 10th, 1973.
Alright, so today we are going to be inserting a nasal gastric tube, and I have to go with a little bit of an uncomfortable procedure, but we're going to try to make it as quick, as painless as possible. Before we begin, would you like me to put in an order for any topical anesthetic to make it a little bit better?
No, I think I'm okay.
Alright. So the first thing I'm going to do is I'm going to measure, so I know the length of the tube. So I'm going to start at the nose. And then can you occlude both nostrils and figure out which one is easier to breathe out of? Alrighty.
I think it's the right one.
The right one? Alright. So we're going to measure the length of the nostril to the ear. And then from the ear to the xiphoid process. The xiphoid process in the umbilicus, which is about 22 centimeters, or inches, I'm sorry. Okay, so I'm going to go ahead and mark that on the tube. First, but before that we're going to just really quickly run through it and see if we can forget anything. We have this stuff, and right here will also be your emesis basin and your water tank. Okay, so you can. Alright, and then I'm going to mark that with a marker. And I'll tell you when to get there. Alright, so we're going to start. So now I'm going to go ahead and put the gloves on. I'm going to go from your. And lower this bed rail as well. Did the curtain part? Yeah, I did all of it. And then we're going to count down to 3, 2, or xiphoid process. And then right below that, okay. Between your umbilicus and your xiphoid. And I will mark this with a piece of tape. Still doing okay?
Yes.
So I'm going to provide you with a water pad just to catch any fluids that falls into your gown. I'm also going to provide you with an emesis basin if you ever feel the need to use it. And also this cup of water. I'm going to ask you to take small sips as it is going down the throat just to make sure that it is comfortable and going down properly. So now I'm going to go ahead and get my tape ready.
I'm gonna try good. And now it's interference, and the patient has started gagging. Karen has stopped gagging.
Alright. So now that I have my tape ready, I'm going to go ahead and lubricate the tip of about 2 to 4 inches. Alright. And then as I'm inserting, I'm going to be cautious, make sure you don't get cyanotic. If you get cyanotic or you're gagging or choking, I'm going to remove the tube immediately and we'll figure out what's going on, alright? So I'm going to go ahead and ask you to put your head back as I insert it through the nose. And then as it enters the pharynx, I'm going to have you put your chin to your chest and then start taking those sips of water, alright? Excellent. You did such a good job. Now I'm going to go ahead and loosely attach it with a piece of tape. So I'm just going to loosely take this to your cheek like that. So now I'm going to go ahead and confirm placement using 2 techniques. So the first one I'm going to use is I'm going to get some gastric fluid. Now clamp it. So I'm going to go ahead and get a little bit of fluid. Beautiful, stick it back in. And use a pH testing strip.
Is less than 5.5, which is normal for gastric.
And the pH is less than 5.5, so that is normal for gastric fluids. So now we are going to draw from X-ray to confirm that again, alright? And now that you're back from X-ray, they confirm that it's in the right placement. So I'm going to go ahead and remove this.
And I will tell you this is an uncomfortable procedure, so you can get anything just
Right. So we start by, and I'm going to attach it more securely to your nose like this, and wrap it around.
And then, would you like an anesthetic tube on your nose before we start?
Yes, actually. I'm also going to provide some skin protectant under the nose, just to make sure that it doesn't irritate it.
I'll ask you which nostril.
And now I'm going to go ahead and connect to the suction.
With including one and then the other, and tell me which one you would like next.
Alrighty. And now that you are attached to suction, I'm going to go ahead and measure the tube again.
Okay, so we're going to take
Starting at the tip of the nostril, down to the exposed tube.
and I'm going to add a little bit of skin protectant onto her nose so it's not irritated.
And there's about 32 inches, so I'm going to make sure to put that in your chart so other nurses know as well. Are you still doing okay?
Yes.
Now that is measured.
Alright, so now I'm going to go ahead and attach this to your gown. I'm going to have you look that way while I do this.
Everything is good. Now I'm
Just
going
to make sure it stays secure. It doesn't move around.
remove this clamp. What we're going to do is lubricate.
We're going to connect to
4 inches.
Awesome. How are you feeling?
All right, you are doing an excellent job. So I'm gonna go ahead and remove my gloves and this waterproof pad.
And I'm gonna measure if I am able to. I would.
And we will be able to remove that in a couple of days when the doctor says to. All right. A couple days later, we are now going to be able to remove the tube. So the first thing I'm going to do is I'm going to assess your bowel sounds to make sure that everything is moving accordingly.
It will help show me if the entity is farther than it should
And listen to that.
So now we're gonna
Alrighty.
Great
job.
I'm gonna have you go ahead and put your
Hands
all the
from
way back to
you
the
and then
pillow.
way.
And then start inserting it like how
All right. Normal bowel sounds were ready, so we are good to remove the tube.
Help you.
And now I'm gonna push the
All right. So then I would log the patient back to normal position. But for the sake of this video, we're just going to go straight to the pump. All right. So I've already obtained health records. And I will be assisting you here.
So the first thing we are going to do is we're going to get that waterproof pad back on you in case any fluids come out. And then also the MSS basin if you feel like you are going to be ill.
now I am going to test the
And here's that basin for you.
location of the tube.
So now I'm going to first remove it from the gown.
Okay.
We could test the pH.
Excellent. So now I'm going to go ahead and remove you from suction.
Or I could bring the patient to the X-ray and also
And now we are going to remove the tape from the tube. Beautiful.
Your bowel sounds are active. Henceforth, I change your sounds. It sounds great. All right. So now I can
content.
begin with the removal of your NG tube. Okay. So we're gonna place this down just in case.
Alright, we have the tape removed, so now I'm going to go ahead and flush the tube.
Use it for vomiting.
This.
Alrighty. Are you ready to begin?
I have the gastric content.
Woohoo! All right.
And putting about 10 milliliters of sterile water down that tube. So now we are going to go ahead and remove the clamp, or the tube. I'm going to
Test it.
have you hold your breath for a second. I'm going to remove it as fast as
And
possible.
I'm going to
Ready?
now.
Excellent.
Now that we
You
have
did such a great job. Go ahead and throw that away.
syringe in there.
And now I would measure the gastric
Take this
contents.
And
And then I would make sure to subtract if there's any irrigant fluid used. And then we can include that in your chart as well. You did such an excellent job. Do you need anything else before I leave?
No, I think I'm okay.
Alright, I'm just gonna lower your bed to the lowest position.
and then wrap these.
So, and then all your personal belongings are on the table next to you. The hall light is in place, the wheels are locked, and the bed is in the lowest position. Thank you so much for your time.
Thank you.
All right.